And we know that we are actually going to get ulnar and median nerve input from small intestine 3. And we also know, it's so fascinating to me to pick up Narda's book about human acupuncture and all the CuraCore little handout books that you have and read. A lot of times we don't even read those, right? We memorize where they're at, but we don't read what that point does. And it's so fascinating to read what some of these acupuncture points do that we don't pay much attention to. And if you look at small intestine 3, you're going to get ulnar and median nerve input, right? So when I use this point, it's a distal point. It's right distal to the split bone. It gets those two nerves, and I'm going to activate ulnar and median nerve with influence on the spinal column. I'm going to activate small intestine 3 with a needle, type 3, and I'm going to come over to bladder 62 right here, because we know in coupling that, when I look at bladder 62, I'm actually going to get fibular nerve as well as tibial nerve with bladder 62. So I'm going to put my needle in here, cranial distal to the lateral malleolus, and it couples with small intestine 3 because this point actually influences the spinal column as well. And when I say spinal column, that is referring to all the nerves that come out of that and back pain, the facets of the back pain. So I'm going to go here and using my distal points for my sympathetic input. Then I'm going, well, maybe I can remember that we have pain going through the bladder channel, comes right down the sciatic line. So I have bladder 36, bladder 37, bladder 39, and bladder 40. If we look at bladder 40 as a distal point, we know that that has impact with helping with all back pain because of where it's at.